I went for my annual screening mammogram. Approximately 2 weeks later, I got a letter in the mail, and I assumed it was the everything's good, we'll see you next year, and it wasn't. So I had a biopsy the next day, and it confirmed that I had breast cancer.
The most devastating news I've ever had in my life, and especially when it's the love of your life that you love more than anything in this world.
There's so much that's unknown. You don't know the staging, the progression. You don't know what treatment you're going to need.
Tufts Medicine is uniquely equipped for oncoplastic surgery because we were the first to believe in the concept of oncoplastics. Essentially, it's a breast conservation option where a woman has one operation, ideally, to reconstruct her breast using her own tissue after a large resection. The toxicity financially and also socially are tremendous the more operations you do. Oncoplastic surgery, 90% of the time, you're done with one operation.
I've never had surgery my whole life until right now, so it was daunting, all the what-ifs. I found MelroseWakefield Hospital. They were one of the first calls I made. Within days of my biopsy results, Dr. Nardello called to introduce himself to me, which, as a nurse being on the other side, I couldn't believe how quickly and how compassionately that phone call was. He reassured me that I was going to be okay. I cried happy tears and made an appointment for me.
When I see somebody who's newly diagnosed with breast cancer, it's a shock. As the healthcare team, we feel it as well, and we want to make sure that the patients have the best outcome possible. They just are so scared about this cancer diagnosis. What does it mean for them? Are they going to be there for their grandchild's wedding or their 20th wedding anniversary? All these things are going through their head. So many times people say, I have to just get it out. The options are lumpectomy, which is where you remove just the cancer with some normal surrounding tissue, a mastectomy with or without reconstruction, or oncoplastic surgery, which is an advanced technique where you can remove the cancerous tissue with additional tissue around there so you get a larger lumpectomy, and we're able to reconstruct the breast at the same time, which gives us a better chance of getting it all the first time.
I was very grateful to have this team. I mean, every step of the way, everybody's made me feel more and more comfortable and less frightened, because it is scary being on the other side when you know what can happen.
What I hear from patients who come to Tufts Medical Center is, I felt like I was part of a family. And I really value that, and I take that very seriously, and that's the type of relationship I want to have with my patients.
It was one day at a time, one appointment at a time, and now I'm very optimistic.
There's no difference in survival in having an oncoplastic operation versus, let's say, removing a breast. And you also want her to feel whole, living the rest of her life, hopefully cancer-free, with an excellent quality of life.
His name is Salvatore. In Italian, it means savior. He saved my wife from me. And thank God we're here, right?
We are.